Good afternoon, everyone. Thank you for joining us on a Friday afternoon. My name is Tracey Woodruff. I'm a professor in the Department of Obstetrics, Gynecology, and Reproductive Sciences, and I'm going to let Diana introduce herself.
I'm Diana Laird. I'm an associate professor in the OBGYN department as well.
And Diana and I co-lead the Environmental Health Initiative, which is a new initiative here at UCSF to link researchers across the campus to focus on environmental health research and communication. And we'd like to thank our co-sponsors of this event, the Office of Research Development, the UCS Office of Sustainability, and other academic centers at UCSF that are co-sponsors of our event, including the Office of the Executive Vice Chancellor and Provost, the Center for Tobacco Control Research and Education, the Philip R. Lee Institute for Health Policy Studies, and I believe this is a new one at UCSF, the Sugar, Stress, Environment, and Weight Initiative. And I just, yeah, right. And this could be stressful times for some of you out there, so try not to eat too much sugar. So it's really great to have everyone here, and I think the number of co-sponsors we have reflect the enthusiasm for the event that we're having today, which I'm going to turn it over to Diana now.
I just wanted to say a couple of words about the importance of this event. And UCSF really has a long history of playing a role in important debates and issues of our time. We're going to hear about some of those from the illustrious faculty members sitting in front of you, and that how these faculty members have overcome the challenges facing them and really unabashedly taken on the responsibility and the commitment to share what they know from their research. And why are we here? What's the purpose of this event? Really threefold. We want to come together and think about our responsibility, as well as the challenges of communicating science to the public sphere. And we really hope that you come away feeling inspired and that this is a call to arms more than a negative. We also recognize that the challenges may include fear of reprisals or accusation of political bias, and we will certainly address that today. And thirdly, we'll really hear stories from the front lines from all of our panelists, and we'll hear about the resources within the university and try to understand the role of UCSF in supporting researchers. That means you.
So our goal of our event is really simple. It's to hear from these really esteemed faculty, and actually we also have postdocs, to talk about what they've done when they speak up about science and what happens and why it's really important and our responsibility to talk about what we know in the public. And we're going to eliminate the misconceptions and fears that some people have, which we have heard from some of the researchers on campus about what it's like speaking up about your science. And I would say that I think one of the great things about being at UCSF, first of all, it's a great job because we get to go out and seek knowledge and do research, but also it's really a luxury, and that's something that we should keep in mind when we're thinking about that, because not everyone has that ability to do that, and it's really important that we share what we know because of that. So I am going to now introduce, because we have a really star-studded set of people who are going to speak to you, because it really reflects that how much people care about talking about science, particularly in the public venue. And so I'm going to introduce Dan Lowenstein, who's our Vice Chancellor and Provost. And I just want to say that Dan has been an inspiring leader for scientific and the science enterprise, but also representing UCSF's commitment to justice, tolerance, and fairness, which I think has become an even more important issue for UCSF to be a leader on in these times. I also want to thank Dan because he's been an early, enthusiastic supporter of the Environmental Health Initiative. When this was an idea that Diana and I just started a couple years ago, we went and met with Dan, and he's like, why didn't we have something like this on campus before? And so I really want to thank you for doing that. And he's been at all our events, and so we'd like to welcome Dan up here to say a few words on behalf of the Environmental Health Initiative and our event today. Thank you.
Thanks so much, and welcome everyone. I'm here really in my capacity as your Executive Vice Chancellor and Provost, speaking on behalf of the Chancellor and the rest of the leadership of UCSF. And I think I just want to frame why it is that we're together for an event like this. We're a university, and why do societies have universities? Really two reasons. One is to generate new knowledge. Society gives us the luxury, the freedom, to explore the world, to explore life, in our case, the life sciences, and to provide health care. And it's to generate new knowledge because we recognize that the world is an imperfect place. We need to make it better in so many ways. And in order to make it better, we need to think about what is our reality, and what can we do to make things better. And the second goal of the university is to train the next generation of people, of members of society, who will carry on the needs of society, including, hopefully, generating new knowledge. So that is why we are here. That's why we exist, and that's why we have programs like today. I'm particularly excited about the topic that's been chosen because I think it's fair to say, at least from my own perspective of being a member of this society for quite a few decades now, I don't think there's ever been a more important time where the generation of truth, of trying to get as close to the truth, has become as important as the times that we're living in right now. Now, we as researchers, as investigators, as faculty members, as staff who contribute to this enterprise, we don't have the corner on the market of truth, but I do know that we believe that there is something that is a truth that we want to get as close to as possible. And with the current political climate, I think we are seeing an assault on what it means to have objective observation of facts and to try to get close to the truth. So an event like today, I think, is really bringing us at that nexus of what is it that we can do to seek the truth through our work in science and make sure that it gets out in the public domain in a way that the rest of society can see what it is that we're producing in terms of the advancement of new knowledge. So I greatly appreciate the way you've put together the program, and I'm looking forward to the conversation. So thanks again for being here. And do you want me to introduce you're going to introduce the next person? Okay, good. Thank you.
Thank you, Dan. So we're really privileged to have another great leader at UCSF here, Keith Yamamoto. And Keith Yamamoto recently took on a brand new position, which is the first ever Vice Chancellor for Science Policy and Strategy at UCSF. And you may be wondering what this is. I am too, and I'm very excited to find out. From what I understand, Keith is now working to really anticipate the needs of the research endeavor at UCSF, which we know is an ever-changing landscape. And he's working to position the research endeavor optimally within the university, but also within the larger scope of the nation and the state, and maybe arguably internationally as well. And Keith is no stranger to policy work. He has done a lot to lobby in Washington for science and for UCSF. And in addition to that, Keith is really, quite a renowned scientist. He has been chair of a department at UCSF. He's in the National Academy and still runs a research lab. So without further ado, Keith.
Thank you. I also want to congratulate the organizers for putting together a terrific program at a perfect time, an essential time. So risks and responsibilities, it says in the title. So let's get right down to it. I would say that biomedical research has three characteristics that mandate a responsibility to communicate with the public and with policymakers about what it is that we do and why we do it. First, watch out for this. Biomedical research is valueless. I don't mean it has no value. But that it's not the discoveries and technologies behind what we do don't have intrinsic value. They're not intrinsically good or bad. It's how they're used. And the decisions about how they're used necessitate scientists being involved in that discussion. It doesn't mean that the scientists will make the decisions, but they need to be involved in making them. Secondly, biomedical research is complicated. It's complicated because biology is complicated, disease is complicated, and the technologies that are used to uncover information are complicated. And so it's not that we're smarter than everyone else, it's just that we're the people that have been involved in making those discoveries and technologies. And therefore, it's really the scientists who need to be involved in in the discussions about what makes them work, what the values are for them, what might be for them, and how they could be used. And then third is that the research endeavor in this country is a big public investment. It's a big public trust. It uses about 1% of the federal budget, so it's not a small number. And so we have a responsibility as stewards of those resources from the taxpayers and citizens of the country to say what it is that we're doing and why. So it comes with a lot of responsibilities. So it's really only if scientists communicate with the public and with policymakers, engage in those discussions that frame policies, that good policies have a chance to emerge. So you can think here recombinant DNA, tobacco, stem cells, fetal research, genome editing, shared data, lots of things that have emerged from science, biomedical research and technology, in which the society needs to be making increasingly complex decisions about how these technologies and bits of knowledge are going to be used. So are there risks associated with carrying out those responsibilities? You bet. There are. The kind of near-term obvious ones are that shining a light on new things that we're doing in this area that can touch on controversy, that could become politicized, carry risks that could threaten our ongoing support from the public, resources, funding. So there's some risks right there. There are deeper ones as well. But far greater than the risk of those sort, and a greater danger than not going is not going public. That if we stay quiet, stay underground, and don't speak up about the things that only really we can speak up about, then it really guarantees an uninformed, non-evidence-based set of decisions that commonly are going to go in the wrong direction. And finally, as Dan was implying, we really find ourselves suddenly in an environment in which core values of science, truth, fact, and evidence are being challenged. Values that are intrinsically, again, not political, but suddenly they're being derided, devalued, denigrated, politicized. So we must not be silenced about the importance of science because it has somehow become politicized and we've been schooled not to do things that are political. And if we get silenced by that, then I think that we're in big trouble. That's one of the reasons that I and others in the room I know are supporting the March for Science on April 22nd in Washington, and over 300 cities now. I don't know if you've been keeping track of the count. Over 300 cities in 30 countries, more than 30 countries around the world. So as Dinah said, UCSF is the first campus to have a Vice Chancellor for Science, Policy, and Strategy. It's the first campus, first UC campus to have an Associate Director for Government Relations, Natalie Alpert, who is here somewhere. Where are you, Natalie? Right there. Who is based in Washington, although she's here today, but she's based in Washington. We need somebody based in Washington. Showing up is half the battle in Washington. You really need to be there, become familiar with the people that are involved in making and setting policy. Natalie's fantastic at that, and so she's really my guide and leader a lot of times when I'm in Washington, and sets up the appointments that we have on Capitol Hill or at the White House or in federal agencies. In addition, I represent UCSF in directing or being involved in at least five other activities in Washington with the National Academy of Sciences, the National Academy of Medicine, with Research America. I direct the Coalition for Life Sciences that I'll mention once more in a minute, and with the AAAS. And these are really to inform UCSF, bring back things from those bodies, but more importantly, to put UCSF's voice into the policy recommendations and advocacy that those organizations represent, to speaking to those that are responsible for shaping our policy, shaping our endeavor overall. Finally, we at UCSF are incredibly fortunate to have elected representatives in Washington, Representative Jackie Speier, who we will hear from, Senators Feinstein and Harris, who are aware of UCSF, support our goals, visit us, and know what it is that we do. That makes a huge difference in our ability to be effective. Jackie Speier in particular is the co-chair of the Biomedical Research Caucus that the Coalition for Life Sciences, which I chair, launched almost 30 years ago, and organizes a gathering of congressional staff on topics of their interests and those that we suggest as well. And it's really great to have her leadership in that group. So we really want, from the position of the office that Natalie and I occupy, and you Hook Barnard as well here, to have UCSF people involved, contributing your voices to the things that you think are important for us to be focused on. We hope that you'll communicate with us in our office, India or Natalie or with me, to raise issues and concerns, to make suggestions, things that you think that we should be doing in Washington to carry the voice and concerns of UCSF forward. Let me just mention one last thing, and that is that on March 27th, there will be a gathering called Advocacy 101 that will really talk about what it is that you do. And the ways that you can be an advocate for positions that you think are important from your own desk, from Washington, D.C., or anything in places in between. So I urge you to come to that. There will be gatherings both at Parnassus, starting at 1 o'clock on March 27th, and at Mission Bay, here at Mission Bay, starting at 3:30. That will take you through that process, and Natalie will be one of the guides for that event, and I think it'll give you a clear idea of how you know how important it is. You will find that it's actually also easy and interesting. So please be available to come to that. But we want your continued input and really look forward to the rest of this symposium to hear these activities.
Thank you. Those were both really excellent and I would say also inspiring. And I hope that it's just a flavor of what we're going to be talking about in terms of how important it is for us as scientists to speak up about what we know. So it's really a pleasure to introduce Jackie Speier at this time, who is a Congresswoman from this area. I had the pleasure of meeting Jackie Speier when I first came to UCSF. So before I was at UCSF, I worked in the federal government. I worked for the U.S. Environmental Protection Agency. You probably heard about it because it's in the news a lot these days. In really interesting ways. And I'm hoping that Jackie perhaps will speak a little bit about this, but she has been, when she first came here, we actually did a press conference together to talk about cadmium and lead in children's jewelry, which she sponsored a bill on, which it just demonstrates how she has been and continues to be a defender about environment, health, and particularly children's health, which is going to be so important in this coming, as we've all know, in the coming years. So without further ado, I'd like to introduce Jackie Speier to come and speak with us today. Thanks.
Thank you, Dr. Woodruff. And let me just say at the outset how thrilled I am to be back at UCSF. I have been here probably 3 or 4 times in the last year to co-sponsor conferences, and whether it was on harassment in academia or aneurysms or breast cancer research or cadmium in jewelry or allergies around Halloween, and you're always such a great resource. I must also say I've been here for family members. And I always, when I walk through the doors, I always feel blessed. I feel lifted up. And I want you to know that what you do is so very, very important. Special thanks to Dr. Yamamoto and to Provost and to Dr. Laird as well. And a special shout out to Dr. Nancy Milliken, who I have worked with for, I don't even know how to say how many years now, is it 15, 20? We started the Young Women's Health Conference decades ago together under the auspices of UCSF. Our very first speaker was Erin Brockovich. So we had all the young women of San Francisco and San Mateo County, and as you would imagine, she kind of rocked the place. And she showed up in a leather pantsuit and a leopard tube top. I'm here to tell you that now, more than ever, what you are doing is critical to the survival of this planet. We are in uncharted territory in Washington. And you don't have to look beyond the front pages of the paper or our president's tweets to recognize how critical we are. So the fact that this has been named Moving Beyond Fear, and this was actually created as a title long before we knew we had to be in fear. But nonetheless, it underscores how important it is for us to recognize that fear is not an option. It's not an option in your work. As scientists, you are serving our country and keeping people safe, just like the members in our military, our police officers, and our teachers. The work you do to save lives and prevent illness and make our world a better place is truly critical to our survival. So at a time when facts are almost passé and fake news is something that we've come to just accept, frighteningly so, we have an administration that is very comfortable lying. So it is really important for us to be strong and clear and purposeful in recognizing that we must give truth to power. So from trivial issues like how many people attended the inauguration to major issues like whether the crime rate is truly out of control, they seem to be following the dictatorial strategy of trying to fit reality into their warped political goals. The fear and ignorance towards scientific discovery are real, especially in Congress. Not a week goes by that I have a colleague who is denying climate change. Not a week goes by. Or equating an embryo with a fully formed baby, literally referring to embryos as babies. Or arguing that sugary sodas don't lead to obesity and diabetes. Our vice president, believe it or not, once stated that tobacco doesn't kill in an effort to defund government research into secondhand smoke. So I am a strong supporter of proven public health measures like vaccines and water fluoridation, which are completely uncontroversial scientifically, and yet politically very controversial. And I want to just take you back in time. I took up the issue of fluoridation of California's water. Only 17% of California was fluoridated at the time, whereas 62% of the nation was fluoridated. And the cost of public health was extraordinary. Something like 2/3 of our Denti-Cal program was attributed to caries. So I took up that issue. I had voodoo dolls that were delivered to my office. We had hearings that went on for 5 hours. People were bused from places around the state, but eventually we got it. So you've got to be willing to stand up to those that are cringing from truth. Stan Glantz has been an incredible leader in standing up to the powers that be, whether it's the tobacco industry or any number of other folks out there. And a shout out to you, Stan, for all the work you've done over most of your life. I want to make a point of telling you that it's really important to have your science, your conclusions highlighted. Now, how do you get it highlighted? Most legislators do not read the medical periodicals that you do. So how do you get it? Well, I'm going to make a suggestion to you today of how you can do that. Get me or Leader Pelosi or someone else to introduce a bill on an issue, and it will instantly get traction. And I'll give you a very simple example. There was a paper done in a peer-reviewed journal, Pediatrics, showing that children were biting into liquid detergent packets and either swallowing the detergent or squirting in their eyes. And since the concentration is extremely high, it was far more dangerous than regular household detergents. So the paper said that in 2012-2013 alone, the National Poison Data System received 17,230 calls involving children exposed to chemicals by these liquid packets. 769 of those calls involved hospitalization, and tragically, one 7-month-old boy died. So we saw the news coverage of this paper, and were shocked. And I happened, one of my staff members at the time was pregnant with twins, and we decided we were going to do something about it. So the Detergent Poisoning and Child Safety Act was created. It was co-sponsored in the Senate by Dick Durbin. Now, the bill never even had a hearing in committee. Not one hearing. We had a huge press conference, a lot of press. We had a mother of a child who had had that exact experience occur, but the child lived, and we got traction. All of a sudden, Procter & Gamble was in my office wanting to talk to me about how they were going to change the packaging so they didn't look like containers of candy, that they were going to change the film on it so it had a bitter taste, so children would be less likely as toddlers to want to ingest it. They came in, they showed me a PSA they were doing. I said, that is not good enough. They went back, they came back, and offered a much more dramatic message to parents about how serious these detergent packs can be. So, it works. The bill never got a hearing, but we moved an industry to do something about it. Now, when I was still in the state legislature, I read an article about a study done by UCSF doctors, Cristin Haller, Neil Benowitz, and Michael Schlipback. I don't know if they're still here. It was on ephedra, and I decided to take up that issue. Now, Metabolife was huge in San Diego, and everyone was focused on the fact that this is the dietary supplement industry and you don't touch them, and they've got a huge population of people that will write letters in opposition. But we went forward, and we established that there were 155 deaths, this study that they did, 16,000 illnesses, 60% of all the calls about herbal supplements that came in to poison control were about ephedra, even though it was 4% of the market. So I introduced the bill to ban ephedra in California. It went through, it got passed, it got signed into law. So we fixed it for California. But what was really interesting about it, even though this information was around, until it was passed in California and the federal government didn't want to have 50 different state laws on it, the USDA took action to ban ephedra. So the action we took here in California ended up impacting the entire country. So we recently had a committee within Congress called the Select Investigative Panel of the House Energy and Commerce Committee that was entitled The Panel to Protect Infant Lives. Now, it was all about fetal tissue, and they had one intention in mind, and that was to shut down the industry. But by shutting down that industry, you know full well you're shutting down science. The reason why we were able to make the link with so many of these long-standing diseases, whether it was polio or anything else, was because fetal tissue was used. It was used, I believe, right here at UCSF to make the link between Zika and microencephaly. But it was fetal tissue. So it is really important that we don't lose sight of the fact that you are on the front lines, not the firing line, but the front lines of making sure that the public health and safety of this country is protected. I'm going to pass by some of this. I just want you to not be afraid. Do not be afraid of those who will try and suggest to you that your science is going to be politicized. Of course it's going to be politicized. But you should wear that as a badge of honor. And I can guarantee you that I will be there with you. I will stand with you. I will introduce bills. We will put spotlights on these issues because, you know, there's nothing more important than protecting the lives of those who are here and the lives not yet born. So thank you very much for your courage and for your leadership and for your scientific minds and for your commitment to a better world. Thank you.
Thank you so much. That was really inspirational. I wanted to let people know that it was a number of different activities were discussed. Actually, our panel members can start trickling up here as I start to introduce you. We are going to actually, Yamamoto brought up the March for Science, which is on April 22nd, and UCSF will be having a teach-in that day. That just was decided this week, so please also watch for that activity as it gets started, because we are a big supporter of the activities around the March for Science, and really about defending knowledge and truth and facts, which I appreciate when Jackie was talking about how we did actually plan this before the election. It was actually based on a previous symposium we had with David G., who used to work for the European Union in the Environmental Chemical Agency. And when we had this symposium, a lot of academics came, researchers came, and one of the things that people raised was, gosh, I really don't know about, I'm not certain about talking about my science. I feel like I might get pushback. I'm worried that people won't think of me as a scientist. And so we envisioned this panel to hear from these really esteemed scientists on stage, to hear their experiences and for people to learn about it. And then the election happened, and then it was like, oh, aren't we so brilliant to think of this at this time? So I also wanted to say, too, that one of the things that I thought was really illuminating to hear talk about, and all the speakers touched on this, was how important it is to be engaged in the public policy process. I think that now it is so obvious to us now what happens in Washington, D.C. will touch all our lives, and even though we can do things in California, which is very important, things that are being decided there will affect all of us. So it's really important for all of us to learn and speak and talk about the work that we're doing. So with that, I'm going to turn to our panelists. I'll just give you a layout of the rest of the session that we're having today. Each of the panelists will speak for 10 minutes. And about their experience. They're going to talk a little bit about their experience, about their research, something that they've done that speaks up in public, some of the pushback they've gotten, and what they've done to overcome that. So I'm going to turn we're going to just go right down the row here, and we're going to start with Dr. Stan Glantz, and you've already everyone I think has already mentioned you. And Stan Glantz is a professor here at UCSF. He's been here for a number of years, and he's done really groundbreaking work on tobacco, environmental tobacco smoke, and also the influence of the industry on science and their attempts to influence science and how he has overcome that. And he's the director of the UCSF Center for Tobacco Control Research and Education. They also run the Tobacco Documents Archive, and I'm going to turn it over to you, Stan.
Well, thank you. I mean, it's really a pleasure to see Jackie Speier again. I remember back when you were in the legislature and you had a bill, I think it was about vending machines, and I went up to testify for it, and I just remember all the tobacco lobbyists coming in and just rolling the place. But now we're rid of tobacco vending machines, so you do make progress. I guess I have a couple of reactions. I think we are very lucky to be here at the University of California, which, unlike many other institutes, I mean, I can complain about this place with the best of them, and tell you everything that's wrong with it at great length. But one thing that I think is really in the DNA of the university as a whole is a commitment to public service, and if you look at what do they look at when they're appointing and promoting faculty, I was actually just doing a lecture for our postdocs on how to survive as a junior faculty member. And, you're judged on teaching, research, university, and public service. And, I think that the system does take the public service component of it seriously. And so in my various misadventures, which included getting the place sued twice, which we won both times. When I first got the tobacco industry documents, which very briefly in May of 1994, a box from Mr. Butts landed in my office with about 4,000 or 5,000 pages of secret tobacco industry documents that we ended up putting on the internet, which I remember when Karen Butter, who was then the librarian, suggesting we put them on the internet, and I said, "What's the internet?" And that collection has now grown to 90 million pages almost, and is still growing. But when I got the documents, we let the media actually was tipped off that they were here, and we tried to keep the fact that they were here quiet while we were writing about them. We wrote 5 papers in JAMA and then a book about them, and I figured we would get sued, but I didn't want to get sued till after the papers came out. And there are many good stories about that. But when the word finally leaked out, Brown and Williamson Tobacco sent their lawyers to UC to threaten Karen Butter, who was then the librarian. And they actually staked that. I didn't see this because the university's lawyers begged me not to go meet this guy. But up on the 5th floor of the library where archives and special collections are, there's like a little room with glass windows. That's where you go to look at archival things, and that's where we'd put the documents. And the tobacco companies sent a private investigator up there to sit in the lounges trying to see who was coming and going. And as it was described to me, it was a kind of 50-ish kind of fat guy, but trying to dress like a student. And I really would have loved, but they said, "We don't want you up there getting in a fist fight with this guy." But when the word leaked out, I remember my office then was up on the 11th floor of Moffett, and the legal office was in Millbury Union. And I got a call saying that the lawyers from the general counsel's office wanted to meet with me about this. And by then the documents had been in the news quite a lot. We'd made them accessible to the media. And I remember as I was riding down the elevator and looking at what had happened with friends of mine, colleagues of mine at other institutions who had been attacked by the tobacco companies, and where their institutions basically said, "We hope you have a good lawyer," and really hung them out to dry. And some of them stopped working in tobacco as a result because they just couldn't afford it. And I was thinking, as I'm going down the elevator, time to walk the plank. They're going to tell me, "It's nice that you had this little adventure, Stan, but, it's time for you to behave yourself." And I went in there, and it was the general counsel, whose name I can't remember, and Chris Patty, who handled litigation at OP then, and they said to me, we've looked at what you're doing, you've done nothing wrong. This is what the University of California is for. And they defended us, and there's a great Frontline documentary called Smoke in the Eye where you can see a clip from the court where he beat them. It was so great. One side of the courtroom was the tobacco companies and all of their lawyers, and on the other side it was Chris Patty, a paralegal, me, and Drummond Rennie, another faculty member, and he won, and it was great. So, I think being in an institution where they actually value this kind of stuff, where educating the public and taking what you know out to the public and being engaged in a positive way in the policy process is valuable, and it's valued, and it's defended. And, I just feel very, very lucky to be here, frankly. The other point, so that's one thing. I want to address this question, and you heard it already, about advocacy. And I get attacked all the time for being an advocate, okay? And I am, all right? I admit it, I'm proud of it. But the difference, there's two different ways you can be an advocate when you're talking about these science-based issues. And it's a question of which comes first. And in my view, the science should drive the advocacy. And if you know something, if you learn something, you have an ethical obligation to tell people about it, to try to tell them about it in terms they can understand, to work with other policymakers and with other, advocates in the community to try to get action done on that. It's no different than, taking what you learn in the laboratory and using it to improve the care of a sick patient by improving therapies. The other way it works is the other way around, and that is when the advocacy is designed to reach a predetermined conclusion. And that's what the bad guys do. That's what the tobacco companies do. That's what the global warming deniers do. That's what the sugar industry does. And I think the way to measure the difference is the following. There's a really good example of this. Dori Apollonio, who's in the School of Pharmacy, and I, a couple of years ago, thought this idea of raising the minimum age for smoking to 21 was really stupid. And I could go on if you want and explain why, but we thought we had really good reasons for thinking this was a really dumb thing. And we decided to go into the tobacco documents and research what the tobacco companies knew about raising the age to 21. And we thought it was going to show that they thought this was fine, didn't matter, it was a big waste of time, it diverted people's attention from things that would work. And what we found was just the opposite, that in fact they were horrified about it. And then up until about the 40s, a lot of the states had 21 as an age, and the tobacco companies put a lot of energy into rolling it back because they thought it was very important to get the age down to it. They wanted to go to 16, but they didn't think they could do it. So they took it to 18 because if they could legally target 18-year-olds, they could reach 14-year-olds. And if you're legally targeting 21-year-olds, it's much harder to reach 14-year-olds. So we ended up writing a paper which has been used all over the country to justify laws raising the age to 21, okay? Now, I see a couple people smiling. In the values of scientists, that shows we're open-minded and honest. That we went to the, we went in with a hypothesis, that the data turned out that what we thought was wrong, and we published a paper saying so, okay? And the people who kind of know my history on this issue and are saying like, oh, Stan, you changed your mind, they think that's an example of somebody who's a high-quality, ethical, honest scientist. You're willing to change your mind, and people pat you on the back for being so open-minded. Now, if I had been working for the tobacco industry and drawn that same conclusion, I would have been fired, okay? And that's the difference. And people should not be afraid to go tell the public what you've learned. They're paying for it. I think you have an obligation to tell it to them. And it's true. If you say things which are not in the interests of these giant, powerful interests, they're going to get mad. They're going to attack you. They're going to call you all kinds of mean things. But I think as long as the work that you do is done well from a scientific point of view, and that you're careful but not cautious in what you say, and you're in an institution like UCSF where they value and protect this, then you just should go do it. And it's a lot of fun because while they did beat back that bill a long time ago, in the long run, we've been beating these guys. And I think, you know, the one advantage of being old is that you have, your time kind of speeds up, and you can see that actually all these times you were just beating your head against the wall to no effect, actually you were having an effect. And I think being here in a place that values that has made that possible.
Thank you. All right, thank you. Now we're going to hear from Cristin Kearns, who's a postdoctoral fellow here at UCSF. She works on the sugar industry documents. You probably know her work because a lot of the work that she's recently published has been discussed in the New York Times, uncovering what the sugar industry has been fooling us about or trying to divert research for many years. And so I'm going to turn it over to you to talk about your experience. Thank you, Cristin.
Thank you. Well, first of all, I'm very grateful to be included on this panel with all these esteemed faculty members. As I'm so early in my career and really just starting out, so I don't have nearly as much experience as these guys. But what I do, so I've been studying the sugar industry, and I came to UCSF after locating internal sugar industry documents in public libraries. And so brought with me 3 boxes in my U-Haul truck when I moved here from Colorado and came here to work with Stan and all the wonderful people here at UCSF, like Rob Lustig and Claire Brindis and Laura Schmidt, with great experience to help teach me how to research these documents and get it out into the public domain. And echoing what Stan said, being here at UCSF, I think, is a key factor, and having the support of the university and surrounding yourself with good people is an important first step. And so Stan, there's nothing the food industry can throw at me that Stan has not already seen. So, if I'm upset about something, I just go to his office. 1998, they said that about me. So I always have a resource, somebody to go to bounce things off. But also the sugar topic is a popular topic, and that's kind of worked to my advantage. And so I think the public is sort of ready to hear about the work that I'm doing, and that helped, I think, the media pick it up and bring so much attention to it. And then having university relations help manage some of that attention was really critical for me. They helped with writing press releases on some of our papers. I got some consulting advice about how to work with the media and really helped alleviate some of my anxiety related to that, which was very helpful. But then I think on a more personal level with how I approach the work, I'm going to borrow from the 4 Agreements, if you're familiar with that book. I think it's really important to be impeccable with your word. And so that rigor and reproducibility aspect of your research, particularly when you're doing work that you know is going to be criticized. I know that the industry is going to try and undermine my papers, from the beginning. So being sure that what I'm writing is 100% accurate, I think, is really critical. The first article that I wrote, I co-wrote with Gary Taubes, and it came out in a investigative journalism magazine, Mother Jones. And I actually had 2 fact checkers assigned to me for that story, and that was quite a training experience for me. They scrutinized every single word that we wrote in that article, and I really learned, even just changing one word can change the interpretation of your sentence. And so that was excellent training for starting to write scientific articles, because what I find in that domain is that I'm largely responsible for the content. It's going to fall on me, so I have to be as accurate as I possibly can be. Second thing would be to don't take anything personally. Because not only are they going to attack your research, but they're going to attack you. And the more you can do to separate yourself from that and just understand that that's part of the work and it's going to happen, the better off you're going to be. So whether it's going to yoga, riding your bike, have something that you can do that's going to keep you centered. And then the third thing would be to always do your best. And the media attention, I guess I really didn't expect the level of media attention that I have gotten on some of these papers. And some people thrive in that environment. The extroverts of the world, but the introverts of the world, that's not our favorite place to be. So knowing that some days I'm better at it than other days, and just trying to prepare the best that I can, but it doesn't always go like you would want it to go. That's okay. It's okay. News cycle moves on. People forget about it. It's not really going to follow you around for the rest of your life. So preparing as much as you can, but not sweating it too much. And then let's see. I think we were supposed to talk about how this has impacted our career. I think the media attention has been really nothing but positive at this point for me. It just, I think, has really raised the level of importance of the work and shown that it can have an impact. And so I'm glad to have had that experience and hope that I'll continue to have a positive experience, but I'm sure things will change as I go on. So.
All right, thank you so much. So I'm going to turn now to Dr. Mike McCune, who actually we interacted because we both work with fetal tissue research. And that's kind of a little bit of different kind of political issues around science that we've been dealing with at UCSF, and he's going to talk about his experience with that.
Good, thanks. So yeah, Tracey and Diana and others, thanks for organizing this conference. And I think thanks to all of you too for being here. I must say, as horrible as these times are, as scary as they are, I've not felt as energized politically since the 60s, when there were just a bunch of us young, dirty, pot-smoking, uneducated people with no clout who fought for what was right. And now the difference is that we're all older, and then there's many of you who are younger, right, who can combine forces actually to do the same thing. And that's a very different situation. And we won the previous one, so we should be able to win this one too. I'll tell you stories about fetal tissue work, indeed. And these began back in 1982 when I came to UCSF. I was going to do an internship and a residency in medicine, about which I knew very little. Dr. Lustig will confirm. And because I had been studying immunology, I had a PhD in immunology. It's what I loved. It's what I wanted to do. I was going to be an X-ray crystallographer and go into a dark closet and study structures of things in the immune system. That was my goal. But then the AIDS epidemic hit. And I was at San Francisco General. Some of you here were there too. And it was horrible. Everybody that I took care of, young men like me, my age, died. 10,000 people in 10 years, from 82 to 92, died at the hospital. And I wanted to do something to figure out why they were dying and also to figure out how to keep them from dying. And that was hard. You could not study them. It was like studying Dresden after the firebombing and trying to have some sense about what Dresden used to look like. That's how far their immune system was destroyed. And even if you could, we didn't have the systems in place. We didn't know what we were looking for. We didn't know how to look for it. So it was, not exactly the kind of lab science that any of us, especially I, was used to doing. So, the search became clear. We needed to have an animal model. The animal model had to be something that we could infect and we could watch over time as the disease progressed, and we could use as a test bed for therapies that might be used to treat HIV. The problem was that HIV likes human cells. It can't infect cells from chimpanzees, but chimpanzees are endangered, and even though they were infected, it took forever, well beyond a grant period, in fact, for them to get sick. There were other viruses that infected other animals, simian immunodeficiency virus in monkeys and feline in cats and so on, but they were not HIV and therefore not necessarily, now we know, in fact, not relevant. So I sat down after leaving UC to go to Stanford to work as a postdoc to ask the question, if I had my favorite ideal animal model, what would it look like? And we just, erased the board of reality. It looked like this. It was small. It would be a mouse, because we like mice and we know how to study mice. It would have within it a human immune system, because that's what the virus needs to have in order to infect, and we could infect it with pathogenic isolates of HIV. So given that set of criteria, obviously this is a mouse that has a human immune system, right? What are the hurdles? So one was that we had to figure out how to get the mouse to accept the human and not reject it, right? And the other was to figure out how to get the human part of the mouse to get into the mouse and not reject it. And those two things, if solved, then created a humanized mouse. The first one we got through by finding a mouse that had severe combined immunodeficiency, SCID, that would accept anything. In fact, it would die. And notably, it died of pneumocystis carinii pneumonia, an opportunistic infection that killed many of the young men that came to San Francisco General. The idea of transplanting anything into that mouse was not new, and we figured it could be a recipient, if you will, for the human immune system. The way to solve the other problem was taught to us, actually, the year I was born, 1954. Billingham, Brent, and Medawar did an experiment that was Nobel Prize winning. It was aimed at trying to figure out how to confer acceptance of skin grafts. Actually, in the military, this was a huge problem, and obviously elsewhere too. And they figured out that if you're a human fetal blood-forming cell, you learn to recognize things that are in your environment, much like, twins that are born and then split, and one goes to Rome, Georgia, and the other goes to Rome, Italy, will grow up genetically identical. They'll have very different outcomes, right, in their lives. So too, a fetal but not an adult progenitor cell can learn to recognize most anything as self, including a SCID mouse. It would follow. So we did an experiment. It's called a Sunday afternoon experiment, where we didn't think it would really work, and it did. We ended up with mice that were engrafted with human organs surgically, fetal liver, fetal bone marrow, fetal thymus, fetal lymph node, and they had a human immune system. Not complete, but it was sufficiently complete that the animals that used to die of pneumocystis no longer died of pneumocystis. And we could use the animals to isolate human hematopoietic stem cells because they were moving through the animal as part of their normal course. And not least, and at least to me most importantly, we could infect them with HIV, and these things would go away. There were three problems. One is we were using animals, and a lot of people that didn't like that. We went out and talked to them, and we convinced them it was better to use a mouse because it was small, right, rather than a chimpanzee, and that mollified at least the local ones. Secondly, the Stanford lawyers were concerned that we would infect our cells with pathogenic HIV, so we were very, very careful, and we also signed letters saying that we wouldn't sue Stanford if we did come to be infected. And then, importantly, I think in the hardest issue for me, and I think for the work that's gone forward, is that we were using fetal tissue that was derived from fetuses that had been electively aborted. This, to me, was an issue not simply because of the prevailing antagonism for that kind of work, but also because I come from a very devout Roman Catholic, Midwestern conservative family. And I had to ensure, because I imagined that this work, if it was really real, would expand. I had to figure out a way to justify what I was doing with my family, if you will. So I teamed up with Paul Berg, who some of you know is a Nobel-winning scientist from Stanford, but who importantly set up in 1975 a conference at Asilomar to talk about the bioethics of recombinant DNA technology, to hold a conference on the bioethics of fetal tissue research. It was at St. Patrick's Seminary, which is down in Menlo Park, and we invited the Bishop of San Jose, Pierre Demen, some of his Catholic acolytes, clergy from other religions, and my Uncle Bill, the priest. My Uncle Bill, the priest, was a dude. I mean, he was the editor-in-chief of the Bible Today, which is sort of like the Science and Nature and Cell, all put together in the Catholic press, and the president for many years of the Catholic Biblical Association and the Chicago Association of Biblical Studies. And so he was there too. And so we talked and we thrashed this out over a day, and we came out with three practices used until now, this is 1988, to ensure that the work that was done with human fetal tissue would be done in a way that would be considered ethical by most, not all. And those were that we would ask that the decision to have an abortion would be done would be made long prior to the time that permission was asked to use the tissue of the abortion for research. Secondly, there would be no change whatsoever in the practice of the abortion in order to use the tissue. And thirdly, there'd be no profit motive, no money that would be made in the process of acquiring fetal tissue for any purpose scientifically. These were all good, but I was most charmed by, and these things happen, this is real. My Uncle Bill the priest, the dude, opined at the conference, having read up on his own, not a scientist, about human fetal development, that the lungs of the fetus, the alveoli of the fetus, would only really be able to oxygenate after 24 weeks, which as you all know is when surfactant has begun to be made. And he, as I'm sure you also all know, in Genesis and in the Acts of the Apostle, had read that the soul of man is acquired by the God breathing a breath into man. And he suggested, therefore, that since this is not possible before 24 weeks, that the use of tissue before that time would be probably okay. I don't know if that stands up in the Vatican, but I was happy to hear that from him. We've gone on, we've used those rules over the years. We have taught many people around the world, and many people around the world are now using either the Model T version that we created back in 1987 or other humanized versions since then. The work has gone on. It's expanded from work on HIV treatment to HIV cure, and there are many other applications that have been able to be approached in the animal model that could not be approached in humans. There have been problems. Okay, so I've had bomb threats. I'll be done in 1 minute. Check. I've had funny boxes, with strange things mailed to me. A shotgun blast blew out the front door of my lab. My family, my girls and I have to fortify our front entrance for fear of stuff like that happening at our house. And my colleagues and I are now favorite punching bags of, those that advocate for the right to life and not having the use of fetal tissue. But I think all these things are part of what one moves through. I'm very happy actually to look back over these 30 years now and to see all that we've learned. And I think this kind of effort and other efforts like it only go on with the support of communities like you. And I think that's another reason for thanking you guys for having this conference today. Thank you.
Thank you. All right, our last speaker, who I will say is actually not at UCSF, but she's nearby at the Public Health Institute. She's a director of the Center for Climate Change and Health. It's Dr. Linda Rudolph, and we wanted you to come and speak because climate change is obviously something that has a lot of science and is a lot of discussion about right now, particularly now with the new administration and their executive orders that are forthcoming. So please, thanks. Linda.
Thank you so much. I really appreciate the opportunity to be here and to hear this conversation and participate in it. I am not a researcher. I've never been a researcher. I am a UCSF alumni, though. But I'm a public health practitioner, and so I am first a consumer of research, second a translator of research, and third an advocate that uses research in advocating for promoting the health of the public. So I got involved in work on climate change when I was the health officer and public health director for the city of Berkeley. And the mayor asked me to speak about climate change at a public forum. And I had spent years doing public health and chronic disease prevention, and I'd never given climate change two thoughts more than when I read something about it in the newspaper in the morning. So I quickly went and consumed as much as I could in a very short time about the research on climate change and health. And two things really, really struck me. One was a sort of, oh my God, reaction. This is incredible. This is like the public health challenge of the century. Climate change is literally an existential threat to humans because it threatens our air, our water, our food, our shelter, our security. And two, that many of the things that I was trying to do to prevent chronic disease, especially in our African American community in South Berkeley, were exactly the same things that the climate scientists were saying we needed to do to address climate change. So there's these huge potential co-benefits from clean energy, healthy transportation, more sustainable and healthy food systems, more greening in our cities, and so on. So I decided that after that, I sort of caught the climate bug and thought, I'm going to go to the state of California where there is nothing, no discussion happening about climate change and health, and we're going to do something about this. And I was fortunate to be able to get a job as the Deputy Director for Chronic Disease Prevention and Health Promotion in the State Health Department, where I promptly started talking about climate change, which I was sort of surprised to find out that no one really wanted to hear. It was kind of like, yeah, you know, we have much more important things to talk about, so just go away. And we were able to start a small climate change program, and we were able to actually get the health department involved with the many other agencies who were very focused on climate change in transportation, in the Energy Commission, in the Department of Food and Agriculture, in Cal EPA and the Air Resources Board. So there is no dearth of people who were very focused on this, but for some reason, it was very hard to get people in the health department to focus on this. And ultimately, because in large part, I think, because I didn't want to shut up about why this had to be a public health priority, as a political appointee, I was told that my services were no longer required. So I went over to the Public Health Institute, where there's a lot of recognition of the importance of climate change. But that experience, and I've subsequently been working really trying to build capacity among public health practitioners around the country, largely working with local health departments, and among practicing health professionals about why climate change is such an important health issue and what the role of health professionals is in addressing it. So that's the context in which I've thought a lot about the role of health professionals, and also why is it that we as a community are not speaking out more about this very, very major health challenge. Margaret Chan, the head of the World Health Organization, has said it is the greatest health challenge of the 21st century. And I want to share a few of my thoughts. But my overall perspective is one that really comes from the Latin proverb that says, "He who is silent when he ought to have spoken and was able to is taken to agree." So I have interviewed a lot of health professionals to find out what they know about climate change, how they see it, and why they're not talking about it to their patients when it's relevant, and it's often relevant, to their communities when they speak to PTAs or faith organizations or their local policymakers or their local hospital directors, to their policymakers at the local, state, and national level, and more to each other. If you look at the table of contents in some major medical journals over the last several years, you will find almost nothing about climate change and health. And that contributes to the feeling among health professionals that they don't really know very much about it. And particularly physicians are very uneasy talking about things that they don't feel expert in, because really one of the most important things we have as physicians and other health providers is our credibility and our knowledge. So people are very reluctant to talk about something that they don't know about, and because we don't talk about climate change in our health professional curricula, and it's not appearing as a topic of great interest in most of our mainstream medical journals. Where are people supposed to learn about it? So that's one thing. But even when they do feel like they're informed or have enough information that they could talk about it and recognize it as a big issue, a lot of healthcare providers are very resistant. And the rationale for that, it's not a priority for my patients or for my community. In other words, because other people who have no reason to be informed about climate change as a health issue aren't raising it as a health issue, I'm not going to talk about it as a health issue. My patients in my community have much more pressing problems, which is essentially like saying that because the 20-year-old smoker doesn't yet have lung cancer, I'm not going to talk to him about smoking. It's too big and overwhelming. There's nothing I can actually do about it, so therefore I'm going to pretend that it doesn't exist, or just, that's not my job. And then the final reason I've heard a lot is it's too politicized. I don't want to bring politics into what I do as a health professional. Even some incredible health leaders basically say they don't want to talk about climate change because it's too political. So I was on a call the other day with Jeff Gunderson, who's a pediatrician and former CEO of Gunderson Health System in Wisconsin, and Gail actually brought him out here for one of her great sustainability meetings. They're the first healthcare system to become energy independent. Basically, they went out and they put solar on, they built dairy digesters, they worked on a whole set of things that made them totally non-fossil fuel dependent. And he said, I don't talk about climate change because when I'm talking to my hospital board or my community, I don't want to antagonize people because climate change is so politicized. So essentially, climate change has become, that which cannot be named, even by people who, unless we talk about it, who will talk about it? Who will inform the public that it's a huge public health threat? When I talk to my public health colleagues about this, and I have this set of reasons that they go through, I sort of think about what are the other things in public health where we've had to talk about topics that people actually don't want to talk about. When we talk about AIDS, we do talk about sex, even though there was a period in time when people felt uncomfortable about that. When we talk about racial disparities, we talk about race, even though that's an uncomfortable topic. So why is it that climate change is this unmentionable topic that's been so politicized? And as has happened with tobacco and the sugar industry, I think it's largely because there's been a very systematic, organized, and well-funded effort to attack climate scientists and to attack climate science. And sometimes it's been the same people. So if you haven't seen the Frontline documentary, Climate of Doubt, I encourage you to do it. Huge amounts of money have poured into climate denial, initially funded largely by the fossil fuel industry, and more recently, they don't want their fingerprints on this, and so the money is being funneled through other organizations, many with ties to the Koch brothers. A single group called Donors Trust, which has as yet untraceable money, has funneled about $750 million over the last decade or so to over 100 front groups to basically deny climate science. And you ask why? Well, they are protecting not just the profits they get from selling fossil fuels to an addicted world, but also protecting the approximately $750 billion in subsidies in the US alone to the fossil fuel industry. And that's an estimate from the International Monetary Fund. And now they have used that money as well to essentially buy politicians and buy elections to get people that believe in climate science out of office. And so now we've got Trump in office, where there's an unprecedented influence of the fossil fuel industry at the highest levels. And, my time's almost up, but just to give you a sense, I mean, you've heard this, but just to put it all together, Trump himself has said that climate change is a concept created by and for the Chinese in order to make U.S. manufacturing non-competitive. Scott Pruitt said that scientists continue to disagree about the degree and extent of global warming. Rick Perry, head of DOE, said it's an unproven scientific theory. Attorney General Jeff Sessions says carbon pollution is carbon dioxide. That's really not a pollutant. That's a plant food. And it doesn't harm anybody, except that it might include temperature increases. So on the surface, one of the most rational people about climate science in the cabinet right now is Rex Tillerson, who for his entire adult career was the CEO of Exxon, which is currently under investigation by the attorney generals of Massachusetts, New York, and California, because there's substantial evidence that Exxon was one of the key funders of climate denial, and that they knew full well when they were funding climate denial that their own operations were causing climate change, and their own scientists were telling them that this is a big, big problem with very dire consequences. But Exxon is still putting out statements saying, this is a preposterous, illogical thesis that we somehow knew all that there was to know about science before it was developed and before the rest of the world's experts. So we are up against a very well-funded group that have been extremely successful, both sowing doubt in the public's eye as to how serious of a threat climate change is, and sowing a political garden that now is taking action as quickly as it can to dismantle the limited progress that we've made to address this threat. And the science also tells us that unless we take action urgently to really transform our energy, transportation, agriculture, and building systems, we are dooming our children to catastrophic climate change that, in the words of one of the Lancet commissions that's looked at this, may cause a, quote, discontinuity in human development and survival. Martin Luther King said, quote, there comes a time when silence is betrayal. And I think that as health professionals, if we don't really across the board sound the alarm and speak out and educate the public and policymakers about what the risks are from climate change and other planetary degradation, that we will have betrayed our communities and future generations.